looking at my notes here, it seems like the first major endeavor from books that I've looked at was in the late 70s when Merck was developing the Hep B vaccine.
Yeah.
And the CDC had reached out and proposed to expand the studies to gay men because the way that gay men have sex is highly effective at transmitting the disease. And then I also have that the CDC built.
I wouldn't say it.
Okay.
I wouldn't say it that way.
Okay.
What I'd say was the incidence and prevalence of hepatitis B was very high in gay men, and I wouldn't try to pretend why it was very high based on the way they have sex. It was just high.
It also sounds like the CDC had built some working relationships with the Howard Brown Memorial Clinic in Chicago and the LA Gay Community Service Center, as well as clinics in Denver, San Francisco, and St. Louis.
Yep.
And then it also sounded like the CDC was acting as the project manager, where they were kind of fostering connections among healthcare professionals and their labs. And they were also in charge of processing the blood samples and determining the dose, and then the placebo groups, and kind of working on all of the logistics as well.
Well, I would say that we were working. This wasn't the first vaccine trial. The first vaccine trial was conducted in New York City, I think, with Clad Stevens at the New York Blood Center, infectious disease epidemiologist and an epidemiologist of bloodborne infections, and hepatitis B was also bloodborne. And in order for the vaccine to be licensed, there needed to be more than one trial. So it was shown to be effective in that trial, but it hadn't been studied in gay men. And gay men would be, if the vaccine were to work, would be a major group who would want to get the vaccine, who should get the vaccine to be saved from hepatitis B. So I wouldn't say we determined the dose. I would say that we worked with them in the design of the trial and worked with the community in the design of the trial, but it was more straightforward than that because the dose and stuff had been previously worked out.
Okay.
And it wasn't so much working with everybody. I mean, the labs were labs that were used mostly to collect specimens rather than not do research. And I don't remember whether the hepatitis testing was done in the local labs or not. Okay. I should remember, but I don't. And we're working with people in the gay community independent of whether the clinic was a health department clinic. So in San Francisco, for example, the clinic was the San Francisco Health Department STD clinic. And I think the same thing was true in Denver and St. Louis, but they were NGOs affiliated with the gay community in Chicago and LA.
Cool. And then I also have here that this was the first time that the CDC or a pharmaceutical company worked closely with the gay community to seek out gay participation for a public vaccine. And this was the first vaccine developed for treating an infectious disease. How do you feel about that? I read that book, but
yeah, I mean, the first one I think is true. I wouldn't say that. I was the chief of the research branch of the STD division at the time, and we had done studies of hepatitis B epidemiology in the gay community before the vaccine trials. So I mean, and they were community-based work. So the trial itself wasn't the first study with the gay community. At least in our group, there were studies that were done of the epidemiology of hepatitis B. And then we'd worked with the gay community in STD control for many, many years. At the time, syphilis was relatively common in gay men. About 70% of the cases, as I remember, were in gay men in the United States. So we had work done there. I don't know about research, though. And then the other thing is that, of course, it wasn't the first infectious disease vaccine. I mean, there's measles, polio, rubella, all kinds of vaccines that go back to the 50s or earlier.
And so you had mentioned syphilis. Do you think talking to someone in LA, they had said that that's still kind of the gateway STD for HIV. Do you think that there's some truth to that, or how? It sounds like if they get syphilis, that's kind of the time to talk about HIV really seriously.
I would say no.
Okay.
The time to take about it. I mean, HIV is so much more important than syphilis.
Right.
The time to talk about HIV is anytime there's a risk.
Mm-hmm.
And you certainly wouldn't wait till you get syphilis. It would be like saying that you wait till you have a stroke before you talk about smoking.
Right.
So syphilis is an STD. And after the AIDS epidemic started, syphilis, the behavior change in the gay community in the United States was enormous. I mean, it was a huge decrease in STDs in the U.S., including syphilis. So while HIV remained endemic in the gay community, and still is, because it lasts forever, it isn't treatable, curable. Syphilis went way down in the 80s in gay men.
Okay.
It's made a resurgence, but it's not nearly the problem that HIV is.
Moving on to the 80s and the AIDS epidemic. In July 1981, the MMWR reported the first case of Kaposi sarcoma among gay men in New York and California. And then I also have here, but the fact that it was put forth by the CDC definitely contributed to part of low press coverage, because that was put out for public health officials during the early part.
Well, the first cases were reported on June 5th, 1981.
Okay.
And that was pneumocystis carinii pneumonia, men in Los Angeles.
Mm-hmm.
The second MMWR was in July,
Okay.
and that was Kaposi sarcoma. Now, the reason there was relatively little press coverage initially wasn't because it was put out by the CDC. I think it had been put out by UCLA or been put out by the San Francisco Health Department. There probably would have been even less coverage. There was relatively little coverage of AIDS in the first year. And of course, the president himself, President Reagan, didn't say the word in public till 1987. But the CDC was keeping track and reporting it every week in terms of the numbers of cases. Eventually, there got to be some traction in the media, but it wasn't taken as seriously as we wanted it to be taken. But I don't think it was not taken seriously because it was the CDC. I think it was not taken seriously because it was just not taken seriously. Now, you might argue, you could argue that it wasn't taken as seriously because it was in gay men, but it's not because it was CDC.
Okay. Do you think...
Because we reported it in gay men.
Right. Right, exactly. Yeah, and so I guess I was wondering, and it also sounded like other labs were reluctant to work with it as well, at least from what I've been remembering initially, because they didn't want that label or stigma associated with it as well.
Well, I think, so first of all, stigma and discrimination played a major role. It still actually does, but not as much. Because stigma and discrimination is central to most public health problems, and it's worse with sexually transmitted problems, and it's worse with gay men with sexually transmitted problems. So that, undoubtedly that carried stigma. Some of the stigma with AIDS was related to the fear of not knowing what caused it, and the fear of dealing with specimens that came from it, that it might have something which is, and also the feeling like there wasn't a lot to be learned by some labs. Now, there were some people that were very much all over it. And the other thing is that it was only occurring for the most part in New York and California at the time. Mm-hmm. And there were essentially no cases anywhere else. I think we had one case in Atlanta, a couple cases in New Jersey in the first 6 months. So large parts of the country, whether it be scientists or doctors or gay men themselves, could avoid the problem or deny the problem. So people were afraid of dealing with the specimens, and then it got to be so people were afraid to go to restaurants with gay waiters. Mm-hmm. There was a huge amount of discrimination and stigma. Right. Actually, when the neglect got, when people started to be more afraid of AIDS, the stigma actually increased. When they were ignoring it, there was less stigma.
Okay.
If it makes any sense. In other words, people thought it was nothing. just a few gay men in California and New York. Then people said, hey, this is probably caused by a virus, which it was, of course, but nobody knew that. Then they start thinking, oh my God, I might get it by eating and dinner with people or whatever. And that's when the stigma really got worse. And I have lots
Hugging
of
someone and yeah. The next thing was the definition of AIDS, and defining AIDS was the next thing that I wanted to ask about. And it sounded like there were certain uncertainties with distinguishing among different illnesses. And it wasn't until June of 1984 that the CDC had broadened the definition to clarify that it's among gay men, drug users, blood transfusion recipients, hemophiliacs, sexual partners of those at risk, and babies born to infected mothers.
I'd say that is definitely no to that.
Okay.
I don't know where you're getting all your information.
Okay.
Follow the MMWR articles. Okay. I mean, what happened was the case definition was a definition that was highly specific for new conditions that had no cause, and they were linked together by severe immune suppression without a cause of immune suppression. So people couldn't have an underlying cancer, they couldn't be taking steroids, they couldn't have congenital immune deficiency. And what you had was an immune suppression that was so severe that the most opportunistic and scavenger-like infections were occurring, like pneumocystis pneumonia, and were killing previously healthy people. And these infections just never occurred in people who had a normal immune system. And then Kaposi sarcoma itself was a very rare cancer, usually a pretty benign cancer as cancers go, occurring in elderly men on their legs, and it almost never killed them. But in gay men, it was different. It was occurring throughout the lungs and it was highly fatal. But there was evidence in the past that was also related to immune suppression, because Kaposi sarcoma was much more common in transplant recipients than in others who are artificially immunocompromised in order to keep their organs. So we were tying these things together in a case definition that said you have a life-threatening or fatal opportunistic infection and or Kaposi sarcoma and or no reason for the immune suppression. And we were not linking it to who you were or how you got it or anything else. It was not a gay-related disease. Now, people in California, some of them wanted to call it GRID.
Right.
And we absolutely refused to do that because we thought this is not a gay disease. This is a disease of immune suppression. And so what happened over time is various other populations were found to have it. Mm-hmm. The first group were injecting drug users, again, who were mostly men and who had mostly perished by the time we could interview them. Now, denial being what it is, people were saying, well, they aren't probably heterosexual, they're probably gay, and they're selling themselves, and they just happen to be drug users. Now, there were a few gay injecting drug users, but not very many. And also, there were a few women who got it who were injecting drug users. And then eventually, there were women who were sex partners of injecting drug users who themselves denied using drugs. Now, the people who were deniers themselves would say, oh yeah, we don't believe them, do you? You know, they're probably prostitutes who are using drugs, and, you know, because the bias against heterosexual transmission was very high, although we believed it. So then the first cases of heterosexual transmission documented were from New York City, and they were published in the MMWR probably in 1982. Then there were cases diagnosed in women, in infants born to women who were either injecting drug users or who were sex partners of male injecting drug users, and they fit the case definition. But again, people were denying it, say, well, no, it's due to something else. You see, we didn't have a cause. You couldn't test for something because there was no cause. The breakthrough was when there were 3 cases diagnosed in people with hemophilia A, or B. Hemophilia is a gender-linked clotting disorder that occurs almost exclusively in men. And in order to avoid bleeding, they would take factor 8 or factor 9 concentrates made from thousands of donors. So each one would be exposed to 100, 1,000 donor a year. And they would all get hepatitis B, and they would get hepatitis, what was then called hepatitis non-A, non-B, which was eventually found to be hepatitis C. But that was a small price to pay to be able to live a normal life and not have strokes and bleed out and get crippled. So the hemophiliacs were the perfect storm, or the perfect canary in the coal mine for a blood-borne infectious agent. So after they were reported in the middle of 1982, people then started to say, this is obviously caused by some new unknown virus that's sexually transmitted between men, but also between men and women, and to newborns from infected mothers, and through blood to blood transfusion recipients, as well as hemophiliacs. And by then, cases were being diagnosed in heterosexual populations in Haiti and sub-Saharan Africa. So that's the history. By March of 1983, we issued prevention guidelines even before the cause was identified. And then later in 1983, the first paper was published by Montagnier from Institut Pasteur. Additional papers were published also by the National Cancer Institute, so that by 1984 it was pretty well established that a retrovirus caused HIV, and it was caused, transmitted sexually to newborns and also in blood. Well, that's brief history.
Yeah, thank you. Yeah, so, and you had mentioned kind of drug injections, and someone had asked me this question. I didn't know this, but do you know how many gay men got it from drug injections versus unprotected sex?
I mean, I could say that if you look at any of the case reports from a CDC, they'll categorize them as gay men, injecting drug users, or both. Okay. Now, I think that in a hierarchy, they would be called sexually transmitted instead of drug use transmitted. But if say you're in New York City and you're a highly sexually active gay man who injects drugs, it's not really possible unless you know the index case and you could do contact tracing to know that. And since HIV is often asymptomatic for years, when you find somebody who's infected, who's a gay man who's an injecting drug user, it's hard to know, how it was transmitted. But most gay men who got it were not injecting drug users. So I think it is safe to say, the vast majority of cases were sexually transmitted.
And going off those lines, the next individual I wanted to talk to you about was Gaetan Dugas and kind of the cluster study. And I know that is some controversy there, and especially with the band Played On. And I honestly don't even want to go into depth with that. I just wanted to briefly talk about the history with working with him. It sounded like researchers had access to his book, and so they were able to trace sexual contacts and the number of people he had sex with. That was useful for creating the networks that determined that HIV was most likely sexually transmitted. And then it was just a typo that the O standing for out of California was changed to a 0 in the cluster study. And that kind of placed Dugas in the center. And then, of course, with Band Played On, it's sensationalized, and he's patient 0. I think Randy Schultz also incorrectly stated that the CDC identified him as the person who brought HIV to the United States.
But we never did.
Exactly.
And Randy Schultz published an article in California Magazine. It may have been even entitled Patient 0. Right. Randy was a journalist, and he published other places in his book, and he identified it that way, and we were quickly denying it. Most of the cluster contacts, what happened was 40 out of 90 living gay men with AIDS in 1982 had direct sexual contact with another gay man with AIDS. And when you think about that, that's almost impossible to imagine in 11 different cities and 7 states. As a matter of fact, if 5 to 10% of men in the United States are gay, and you wanted to randomly see how likelihood that would be, you're from Georgia Tech, all this kind of stuff. The likelihood is 1 times 10 to the minus 12th. What it said was there's something obviously linking these people together. Now, we didn't have a cause yet. If you know the natural history of HIV infection, you could speculate and how we could possibly link these people together anyway. because a lot of them don't get sick for 5 to 10 years. But it was true. And it wasn't all from his book. It was from interviewing each other and things like this. But it did provide a stronger view of the infectious etiology and the sexual transmission. Although people still denied it. I mean, it wasn't until the hemophiliacs were found that everybody, and people would say, well, they all went to the same kind of places. They were exposed to poppers in the same clubs. They were, there's a lot of ways you can deny it. Mm-hmm. But I think it added to the evidence that could then add to the prevention recommendations to warn people.
What was it? I know this is kind of an aside, but I did want to ask, so in the band played on, it does show you kind of going out to these different places like bathhouses. What was that like for you to go and experience that piece of society?
Well, a lot of us, Dr. Jaffe and I and Dr. Darrow, worked in STD research for many years before that. And we worked with the gay community in hepatitis B epidemiology studies and hepatitis B vaccine trials. So it wasn't the first time we'd ever done that. I think what was most rewarding, I would say eventually, was the enormous support of the gay community, particularly in areas where AIDS was diagnosed. So, in other words, California and New York, people were really, really, really worried about this because they were going to funerals, and it was horrible. And so, in our studies, whether it's a case control study or cluster studies, people were very willing to participate. And I think in general, the band played on movie, has Harold Jaffe going to this bathhouse, and the bathhouse guy says, well, we can't have you here. And Selma Dritz says, cut the crap, let us in. I mean, that's all kind of sensationalized. But I think that, the bathhouses were commercial establishments, and they were very, very, very busy. Mm-hmm. And there was an STD epidemic in straight people as well as gay people in the late 1970s, but there was a huge epidemic in gay men. So, for example, I was doing work in San Francisco. The STD clinic in San Francisco would see about 400 patients a day in 1980, 81, probably 95% were gay men. But by 1984, that was down to about 40 patients a day. And that was because the gay community was scared to have sex. And a lot of people were dying, but there was huge behavior change in the gay community in the mid 80s. Because of AIDS.
And it also sounds like some of the places just kind of got decimated, like from speaking to some of the long-term survivors, like the leather bars and the more sexual places, those were kind of the first people to go. And it sounds like even within the gay community, there was still kind of impact in different groups.
Well, people were, it was the leading cause of death in gay men by a long ways. Mm-hmm. In other words, it was up there, mm-hmm. But in those days, if you walk, I had a good friend of mine his name is Don Abrams, was a young gay physician then. He's now an old gay physician, but he was an oncologist, mm-hmm. and we would, I would, every time I'd travel, which was every week, I had friends who were gay physicians, and they would tell me about their experiences. And we were walking around Castro in 1983 with him, and I said, this used to be a crowded area. Mm-hmm. And he said, they've all died. And he wasn't being just cynical. We're talking about thousands and thousands of gay men in San Francisco dying and people going to funerals every week. And they were scared shitless. They didn't go to gay bars. They didn't not go to gay bars because they were discriminating against gay bars. Now there was an effort to close them in San Francisco that was started by Mayor Dianne Feinstein. She's the one that wanted to do it, and it was partly because of the deaths. And the doctors in the gay community were initially very much pushing her to do it. Then they kind of chickened out a little bit, and it was controversial because it was the condemnation of that lifestyle. Right. But it was all part of it. Okay. I wouldn't use discrimination as the major word in that regard. I'd use fear. people stopped going because there was no cure, no care. I mean, everybody got HIV died.
Right. Yeah, it was a death sentence. Yeah.
Until 1995. So, a long time, even after the virus was discovered, there was no way out. And there were 60,000 people dying every year by 1994, 1995, and 80% were gay men. And they were young.
Right. Yeah.
Pretty scary.
Yeah. Even looking at movies like The Normal Heart, they were like, 19, like 20s, 30s, 40s. It was kind of.
Larry Kramer wrote it.
And he was quite a character.
Yeah.
I don't know if you've met him, but
I knew him very well.
And then is it true? I guess this is off topic too. So was it Anthony Fauci who had given him the kidney transplant? Do I have that correct? I think he needed some transplant.
He got a liver transplant, I think, at Pittsburgh. I mean, Fauci didn't do it himself. I don't know if Fauci had any role whatsoever, but he needed a liver transplant and he got one.
Okay. And he was the first HIV positive person to get one?
I don't know that, if that was true or not. I know he did get one.
Okay. I wanted to talk a little bit about transitioning into the 90s. And so here I have that you were the head of the CDC's AIDS task force throughout the majority of the AIDS epidemic. This paragraph talks more about the definition of AIDS and kind of the pressure that you faced from the general public as well. Then I guess here I do have a line here that's in 1985, the CDC said that at least 10% of those with AIDS are gay and use IV drugs. But then the CDC would put them into the gay and bisexual category. And I know we talked about that a little bit earlier, that there was still some fragmentation going on, it sounds like.
Well, how can you tell? I mean, to me, it's from an epidemiologic point of view, from a public point of view, it's a little like dancing on the head of a pin.
Okay.
I mean, if 90% of the cases in gay men are not using drugs, right, and 10% are using drugs, then you can say you're falsely attributing that to being, it's still gay men. So you can say, well, how did they get it? And the answer is, we don't really know. That you shouldn't share needles and shouldn't have sex without condoms. I mean, it's not like you could pick one of those things and say someone is safe.
And then for this next part, I have women, because I know that I have here these postcards that they had sent. It sounds like, and I wanted to talk a little bit about.
I got 20,000 of them.
20, so I wanted to talk about that. It sounds like the situation for women was also problematic because the definition was not as inclusive of women. And I had spoken to a lesbian actually at the CDC, and she had said that women died twice as fast. Because stereotypically women kind of, move on with things. They have a cough, but they have to take care of their family. So once they get the diagnosis, it's a lot later than for men. But then as far as kind of the definition and getting benefits, it sounds like I have here. So it sounds like, for example, yeast infections due to HIV were listed, but vaginal yeast infections were not. And so since some of these women had infections that were not part of the definition, they were denied disability benefits. And then the other issue is, if an infection is not part of the definition, it's not researched. And so many women were not going to have any treatments coming down the pipeline. That was what it sounded like was.
Yeah, that was the activist cry.
Okay.
And the way we responded to it. So there's a lot of things to unpack here.
Right.
The first thing is, how do you determine whether you're disabled and be eligible for disability? Mm-hmm. So what the Social Security Administration should have done was to take everybody with HIV infection and have a disability determination based upon disability. They refused to do that. They said, what we're going to do instead is we're going to use CDC's surveillance definition. And if you have the surveillance, if you're positive in the surveillance definition, which is highly specific for the end stage of HIV, then you're considered to be disabled.
Okay.
We objected to that. We said that's not a disability definition, it's a surveillance definition. However, the government, the activists and others didn't have any access to the Social Security Administration, but they had access to CDC. So they said, well, if they're going to use that, then that should be expanded to fit more people, basically. Now, just from an activist point of view, women who have sex with women as a group were about the lowest risk of people for HIV in the country. Now, that isn't to say that bisexual women, women who injected drugs who had sex with women had no risk. But in general, the lesbian community as a community was united with their gay brethren to be activists. And they were doing so on behalf of women, most of whom were straight, not who were lesbian. And that's important because lesbians were just basically not at risk from having sex with women. And they've never been at risk of almost any STD from having sex with women. Now, if they also have sex with men or they have injecting drugs, that's different. And so the question is, what other things? So AIDS was moving along and getting treated as outpatients in the later 1980s, and not being diagnosed in hospitals with the same life-threatening conditions. And it was true that the communities that injected drugs and their heterosexual partners were dying sooner, and they were often dying without an AIDS diagnosis, and maybe their HIV was determined later. And so the question became, how do we recognize, and they were mostly Black and Hispanic minorities, and at the time mostly in the East Coast. So a lot of these cases were being missed from a surveillance point of view, and hence also perhaps from a disability point of view. The problem is that vaginal yeast infections weren't one of those things. And vaginal yeast infections occur in everybody, and anybody with a vaginal yeast infection isn't severely at risk of death, and certainly not disabled. That didn't mean that women with HIV didn't get vaginal yeast infections. And disseminated yeast infections were part of the definition. And then the other one was cervical cancer. Now, cervical cancer was more common in people with heterosexually transmitted HIV, but it's also more common, it's a sexually transmitted pathogen. It's more common among everybody with STDs. And so everybody who had an abnormal pap smear wasn't severely disabled due to HIV, but some might be, right? And also most of the people who were being missed were not actually women, they were straight men. It was true that a lot of people were disabled who didn't fit the case definition. So we did something quite dramatic, and we expanded the case definition, not specifically to cervical cancer, but we made it an immune status case definition, and we essentially tripled the number of cases in the United States.
Right. And that was in 1992?
No, it was later than that.
Okay.
But the thing is, we said it's related now to CD4 count instead of condition. Like pneumocystis would still get you there, but if you had a CD4 count of less than 200, didn't matter what you had. You could have cervical cancer or vaginal yeast infections or whatever. That would count as AIDS, because also that would count for the need for treatment. So it was a way to identify people who were seriously ill with HIV, and they didn't have to have one of these target conditions. So that what that did was it tripled the number of cases, which tripled the number of people eligible for Social Security. So Social Security wasn't too happy about it, but that's their fault. Now, the postcards were basically sent by thousands of people who said I was killing women and all that stuff. That's just part of the working in AIDS.
I guess the NIH got its piece too. So in December of 1990, on World AIDS Day, ACT UP staged a protest outside of the CDC, and it sent you those 20,000 postcards. And it sounded like the three main things they wanted was the CDC changing its definition of AIDS, having more women in clinical trials, and getting disability payments. And it's also interesting because it sounds like the protests also transitioned to smaller actions where the CDC was almost monitored, and then if they attempted to change the definition without considering women, that they had these like networks where they would alert each other, and people sympathetic to the cause, and kind of encourage them to reach out to senators and congressmen.
Yeah.
So can you talk a little bit about that? It sounds like there was still that pressure even after.
So you've probably read David France's book, How to Survive a Plague. And I wrote a review of that for American Journal of Public Health. To say, first of all, activism was extremely important in the response to the AIDS epidemic. And it was a model for other conditions later on. You know, that didn't mean that activism was always right, that we always appreciated it. It wasn't sometimes unpleasant for those of us in government who thought we were working with people to save their lives. But it was extremely important. And without it, things would have gone a lot more slowly. I never took it personally, just like I didn't take the awards I got from the gay community personally, because it was a group effort and a group blame. But also, we'd go to meetings, you know, and there'd be people in ACT UP or the Lavender Hill mob, which preceded them, who would be screaming and yelling at us. And then you'd come to another meeting a month later and you'd say, well, where's Bill? And they'd say, well, he died. So these activists were fighting for their lives. And that's different from fighting for your bureaucratic life or your clinical life. And so they had a lot of courage and became extremely well educated. You can tell from David France's book and others that they were very knowledgeable. Now that doesn't mean they were always right, you know, or that they were always fair. You know, they hated Randy Schultz, for example. You know, well, Randy Schultz did a lot to waken people up too, but they thought he was an opportunist. I mean, you know, I'm just saying that but the activism itself was extremely important.
And science isn't, I mean, it takes so long. I mean, coming from this perspective that I can understand that too.
Yeah, but even when it's fast, people aren't happy. Like COVID.
Yeah, oh, absolutely. The last question I had to end it on a more positive note was pulling this excerpt that I had found online from an ACT UP website. So it says here that, proud as he is of his daughter, Curran says it troubles him to think that he's a member of the last generation to go through life without AIDS. And in the NIH oral history of AIDS, Curran mentions something else that nags at him. It emerged in his interviews with the actor in New York who died in his presence. Curran was struck by how much he and the patient had in common. Both men grew up near Detroit. They were about the same age. They attended Catholic high schools. While Curran went to Notre Dame and medical school, the patient attended Yale and became an actor in New York. The differences between us weren't great, Curran said. He was gay and I was straight. My final question here is, it seems like going through the 80s, gay men were very cautious of authority figures, yet you managed to get their trust and help them. So how do you think that came about? What was the work like to build those relationships?
Well, I think I'd worked in STDs. I was never, you never want to say never about anything. It's like when people say, I've never been a racist. You think, okay, but I would say generally I was never homophobic in the true sense of the word. I was not unfamiliar with gay people, and I was not fearful of gay people. And I thought that AIDS was a plague cast upon them, and they didn't know it was coming, and they couldn't know it was coming. And before the virus was discovered, there were 500,000 gay men infected in the United States. And that meant that the risk would continue for everyone's lifetime because the virus lasts for everyone's lifetime. So the risk is unfairly hoisted upon a community because of who they love. And there's a lot of huge discrimination in society, which still exists, but I mean, it's not the way it used to be. Gay marriage was nobody got married. I mean, you couldn't get married. And there was a huge amount of discrimination and stigmatization. Gay people were only recognized if they were a stereotype. They weren't out throughout society. And I always thought that was unfair. And I went into public health, and I worked in STDs. So you can't be shy about sex if you work in STDs. Absolutely. And if you're not shy about sex and you don't think gay men are different from straight men and women, except that they're gay, You know, I mean, then it's easy to say when something happens which is killing them, that's fundamentally unfair, and that's more important than anything else. And eventually, you know, with certain problems, you reach a tipping point where the problem itself becomes more important than the stigma. And that happened eventually with AIDS, when people started to say, not everybody, but most people started to say, this is really so bad that we're not going to be thinking gay straight stuff. We're thinking we got to do something about it. And so to me, it was easier for me to do that, because I never remember being uncomfortable with gay people, nor feeling like they were uncomfortable with me. I mean, I could, you know, and I had a lot of meetings in gay bars and meetings with the gay community and meetings everywhere, and I never felt uncomfortable. And so when you say, why didn't you feel uncomfortable? Why should I feel uncomfortable? You know, it's hard reason.
It sounds like you just talk to them like they.
And if you're uncomfortable with it, if you're uncomfortable with them, they're going to be uncomfortable with you. But you know, I always felt the same way. If I went into a bar and everybody was black and I was white, I wouldn't pay anything. You know, I mean, it was just, I don't know, that I was raised that way, or I was just always comfortable. That doesn't mean I was knowledgeable or that I was trusted. That's different. But I mean, it's easier to be trusted if you're comfortable.
Right. How do you think that trust developed? Because that definitely takes time. And since I'm interested in the medical field, how do you work together to build that? And you know, even these days, it seems like there's a lot of mistrust, especially with gay men and their doctors. And, you know, here in Atlanta, there's like, I think 4 openly gay primary care physicians or something like that. And I remember
there were none. We tried to do a case control study. We were trying to find out. There was something called the Atlanta Business and Professional Guild. And that was a group of professional gay people, women and men, didn't use the word gay. And I got introduced to them, eventually got an award from them. And so there's always been gay people around. and we tried to figure out, who were the doctors? Who did they go to? Who would you go to if you were a young person needing a doctor? And we had a hell of a time finding anybody in the early 1980s. Eventually did, you know, it was extremely hard. That's, you know, it ought to be a lot easier now. The Atlanta Network, AIDS Network, or whatever it's called, the Atlanta, you know, should have a listing of people, and, you know, I mean, it shouldn't be that hard, but it still isn't that easy.
I think my friend was telling me, I have these 2 doctors who are in the area. This one takes my insurance. So that's how I picked my doctor.
Well, and then doctors themselves don't like to be pigeonholed. So in other words, you can be a gay doctor, comfortable seeing gay patients, but you may not want to have only gay patients. You know, and doctors are you know, have their own characteristics.
That makes sense. Well, thank you for the hour. Thank you for.
Well, good luck in medical school.
Thank you so much.
What is right? No, I can't recall where